Okay, you guys. All right, I'm good to go. I can go ahead and get started.
We're good, it's already taping.
Okay, so for just a moment, I want you guys to imagine that you're cold, wet, you smell something funky, you're not really sure if it's coming from you, and you just remembered that you're supposed to be home before mom and dad get there. Except that you're 84 years old, you're incontinent of bowel bladder, and you've been sitting in an emergency department stretcher for 5 hours. You have no way to communicate this but through aggression and anger. So dementia individuals take an extreme amount of patience and understanding to care for. And sometimes we can't always address them the way that we address people who still have their cognition and their understanding skills. So sometimes we have to address them a little bit differently. As you choose your specialties to go into, the likelihood of you going into a memory care unit or a long-term care unit is slim. But dementia clients don't always stay in memory care units. They get sick, septic, aggressive, and get sent to the emergency departments. They fall and break hips and have to have hip and knee replacements. And sometimes they have strokes and they have to go to rehab units and be equipped with different tools so they can return where they came from. So even though you may not choose to work in a memory care unit, the likelihood of you caring for a dementia client is pretty high. So dementia clients will need an exceptional amount of kindness and patience to care for. And the disease affects their cognition and their memory, so we have to address them a little bit differently. They may express needs completely different, and we as the nurse have to figure out what they're trying to express. And it may take some critical thinking and some creativity to address those needs. I'd like to talk about this subject because I'm a trauma emergency nurse at St. Francis in Tulsa, and we see these patients for a variety of reasons. Some of those top chief complaints include falls, increased confusion, aggression, and sepsis. But we're a very busy emergency department. Sometimes we have hours between 15 and 16 hours, and sometimes even longer than that. Our acute care areas have taken on hallway patients, and those hallway areas often accommodate the clients who come from nursing homes that can't be left alone in our waiting room, like dementia clients. So even though we might have one sedated and intubated patient in one room and a cardiac arrest arriving in the other room, our dementia clients sit in the hallways for hours on end. And even though we lay eyes on them, make sure they're breathing, no any distress, we don't always have time to meet the basic needs that arise while they're in our care. So I'm going to talk a little bit about alternative interventions and addressing needs here. And understanding what the client needs can be difficult and time-consuming. But we have to remember that their brains are not like ours anymore. They used to be. In fact, some of them were likely quicker and sharper than some of us. But their communication now looks a little bit different. And it's going to take some serious consideration for us to understand what they need. You may need to figure out, you may think you understand and you could still be wrong. For some reason, I keep forgetting that part of speech. I'm not sure why. But most clients that you take care of are going to be able to express their needs. They're going to be able to press their call lights and ask for a glass of water, or ask if the doctor is okay with them eating something now, or, hey, can you put the side rail down? I really need to get up and use the bathroom. But the dementia client may communicate in ways that give us no hint at what they could possibly need. And some of that communication may look like throwing blankets on the ground, or tossing and turning in bed, or getting undressed, or just expressing the need to leave or get away. They may say, I need to go home. They may say no to every single question that you ask, even when they mean to say yes. And sometimes, if they're in pain, that gets expressed in really high emotional states like aggressiveness and hitting. So while most clients can communicate their needs, dementia clients often communicate with their emotions. And although we may not understand what they're trying to communicate, it's pertinent that we investigate the situation. So for example, like in the emergency department, we're often very busy and we don't always address things as properly as we should. We do things quickly. We utilize restraints for aggressive patients. We use medications so that we can finish nursing care and diagnostics. And oftentimes we'll just reposition a patient in bed so that they won't fall out of it. So although we may not understand what they're trying to tell us, we do have to investigate a little bit further. These interventions, like the restraints and the medication, are often quick fixes, and once the medication wears off, the behavior returns. And restraints might work, but they may only work for just a little while, and they're likely to become entangled in them, risking their safety. So, by utilizing alternative interventions, we can meet those underlying problems. And even though alternative interventions may not always work, we can utilize them in conjunction with restraints, repositioning, and medications. So, according to the Mayo Clinic on Alzheimer's, dementia clients often have preserved skills, including singing, dancing, drawing, recalling early life memories, and sometimes their career skills will stick with them. Those are thought to be preserved because that part of the brain is last to be affected during an Alzheimer's disease. So we can utilize this information from the Mayo Clinic, and we can address those behaviors that arise while they're in our care. So these patients not only need food, water, and bathroom breaks, but they might just become bored or uncomfortable and restless in an unfamiliar place. So for a woman, we might say, "Oh, I have a baby doll, would you mind, or I have a baby, would you mind rocking it to sleep while I go do this or that?" Or, "Here's a stack of towels, would you mind folding them? I'm really busy doing this." And that just gives them a little something to do with their hands. Another great tool that I just found out about, apparently it's been around for a while, is a fidget bib or an apron. So dementia clients often want to pick at things like their shirts, their blankets, things on their bedside tables. So that fidget apron can kind of help fix that need to pick at things. I had a picture of it, but I will send you all my PowerPoint when I'm done so you can see what it looks like. And another great tool that we could utilize is puzzles. So people that work with their hands, like woodworkers or engineers or cabinet makers, we might want to give them puzzles. They also have like a little wood trinket with boxes and little things that they can like pull out and put back in. So that can help occupy their hands for a little while and keep them busy doing that. So even though these seem like quick interventions, we can utilize those in conjunction with those restraints and medications and repositioning. Another thing that we want to be concerned about is pain. So pain can cause them to become aggressive or hit, or just they won't be able to sit still. So they may not be able to communicate that properly, and again, we'll have to use our investigation skills. So some things to look for is like favoring one side, or they may wince or moan when they get up, or they might be rubbing their hands or their knees, certain parts of their bodies that are hurting them. So that's another way to address some of those behaviors. In a study in Alzheimer's care today that was completed by Dr. Curry, Dr. Terry, and Dr. Logston, they proved that cognitive behavior can improve with cognitive interventions such as folding towels, rocking a baby to sleep, or using a puzzle. And it improved their cognition and their mood as well. So if we use our creativity and our critical thinking skills, we can also improve their moods. So as we work to meet these behaviors and we do our best to understand their communication styles, we can make the delivery of our care a little bit easier on us and easier on them. We have to enter their reality instead of demanding that they understand ours. So even though your client's becoming aggressive, then they might be swinging on you, just try to remember that they could just be wet, cold, and in their reality, they're supposed to be home before mom and dad come home. So, and that's it. That's all I have.